This is Periodontal Assessment Project for Advanced Clinical Procedures by Tanea Ambrosio. This is Kathleen O'Malley, my periodontal assessment patient. She is 71 years old and is currently the owner and operator of a bar. She's a heavy drinker and has admitted to rarely brushing her teeth before bed and never really flosses. Her husband passed away several years ago and she currently lives alone with her cat, Scooter. She's concerned about her dental health, but she doesn't seem to have a whole lot of knowledge and she doesn't seem to have a whole lot of drive to fix the issue, other than she says she wants a wider smile. I think we have a long way to go before that happens. She is currently taking 2 medications. The first one is Propofol for her hyperthyroidism. This drug affects vitamin K levels, which can increase bleeding. It is also contraindicated in individuals with liver disease, and since she is an alcoholic, this should be monitored closely. She is also taking Benicar for her high blood pressure, which is caused by her hyperthyroidism. This drug increases chances of orthostatic hypotension, and therefore the patient should be sat up slowly and rest a minute before standing. Benicar also causes xerostomia. As you can see from the periodontal charting, the patient exhibits generalized bleeding upon probing and recession. She has 15 teeth with probing depths of 17 millimeters or greater, putting her at about 47% attachment loss, well above the 30% needed for generalized. She has grade 2, 3, and 4 frications and mobility of 2 millimeters or greater on several of her teeth. She also presents with a clinical attachment loss well above 5 millimeters on many of her teeth. Her AAP classification, generalized severe chronic periodontitis. She also has a 4 periosystematic disease with her hyperthyroidism, which is an autoimmune disease. There is also an abscess of the periodontium located at tooth number 14 and conditions of mobility on tooth 2, 4, 17, 32, and frication grade 2 on 3, 15, 18, grade 3 frications on 4, 14, and 17, 19, 31, 32, and grade 4 due to recession on grade 1, 2, 30, and 31. Her ADA case type is a class 4 severe periodontitis with generalized over 30%. Her teeth numbers are 15 out of 32 exhibiting probing of 7 millimeters or greater, bringing her to 47%, well above 30%. She has generalized bleeding, frications, and tooth mobility, both horizontal and vertical, as well as radiographic bone loss, both horizontal and vertical. Her crown to tooth ratio is 2:1, and she has greater than 30% radiographic bone loss. Her gingival color presents as generalized dark red or cyanotic with localized blanched areas. Her gingival contour has generalized recession with localized areas of rolled and festooned with papilla that are punched out, cratered, and bulbous. The consistency is generalized severe, soft, spongy, and swollen, with both free and attached gingiva involved. And the texture presents as generalized severe loss of stippling. Here are the assessment statements we just went over. Feel free to pause here and read at your leisure. Here is the patient's radiographic image. As you can see here, there is visible calculus, a 2:1 crown ratio, as well as a CAL greater than 6 millimeters. There is a grade 2 frication as well as a grade 3 frication. That could be classed as a grade 4 if the gingival recession exposes it. There is an unilocular non-corticated radiopacity on the lower mandible area between tooth number 18 and 19. In this first gingival slide, you can see the texture of the tissue is soft and spongy, with a color that is generalized dark red. There are visible caries on tooth number 30 and 31 that can be partially attributed to her hyperthyroidism and her alcohol abuse, as well as her poor oral hygiene care. She also has a grade 4 furcation visible on number 30 and number 3. There is also significant recession visible on number 7. In this slide, the cratered papilla are clearly visible along with 2 more grade 4 furcations on tooth number 2 and 3. There is also a large area of decay on the distal buccal of number 2. In this slide, you can clearly see the patient presents with generalized bleeding upon probing and a dark red and cyanotic coloring to the gingiva. There is also a rolled margin above number 6. And last but certainly not least, the pièce de résistance in this ADA case type 4. Here, the patient presents with dark red generalized with localized blanched and white areas. She has generalized recession with localized festooned margins clearly present on number 27, as well as a very bulbous papilla between 27 and 26. There are areas of the papilla that are also punched out and cratered, and there is visible gross calculus and a periodontal abscess above number 14. And the gross calculus is on the lower anterior, well, it's everywhere, but lower anteriors, you can see it on the upper anteriors as well. The patient's prognosis is poor to questionable due to the fact that the patient exhibits advanced bone loss, grade 3 and 4 furcal involvements, areas of 2 millimeters or more tooth mobility of both horizontal and vertical movement, and she has a poor crown to tooth ratio. Her outcome is continued and frequent maintenance of pocketing and teeth with furcations, as well as her regular perio maintenance. The short-term goals that we have for her are to reduce bleeding and inflammation, have her restorations completed, remove heavy calculus deposits to begin our scaling and root planing process. In the long term, we would like to slow and hopefully halt the progress of the periodontal pockets and periodontal bone loss, maintain furcations through frequent dental hygiene appointments, 3-month or possibly even 2-month recall. Modifiable risk factors that she can change are her frequent alcohol use, her oral home care, and we can address her xerostomia problems. Non-modifiable risk factors are her hyperthyroidism. For treatment planning, we will start with limited oral exam problem focused, so D0140, and move to a preliminary debridement. And then we will probably move back to a comprehensive initial evaluation. That will be a total periodontal screening. Then we will go bring her back for 4 quads of SRP, and there will probably be antimicrobials and irrigation used, which is D4381 and D4921, respectively, after which she will be on a perio maintenance schedule. That's D4910, and she will receive in-depth oral hygiene instructions. As you can see here, as noted in the previous slide, we will do an examination of a limited oral exam, do a preliminary debridement, a comprehensive exam after that. Then we will do 4 quads of SRP. Since she does have hyperthyroidism, we were going to have to go slow. We don't want to cause a stress, and that will cause issues for her. She can go if we raise her anxiety and stress levels, it can cause a thyrotoxic crisis. Also, this patient, epinephrine is contraindicated, so we will have to deal with that. Also, she will be on perio maintenance. She will not be a regular prophy after this. And we will do antimicrobials, gingival irrigation, topical fluoride, and oral hygiene instruction as stated before. For instrument selection, as you can see here, we have our Gracies, and we will use our standard, after 5, and mini 5 with shanks that are standard and rigid for light to moderate calculus removal, fine scaling, and finishing curette. We will use scalers for moderate to heavy calculus removal, and we will use ultrasonics for we will use the Powerline 1000 for gross debridement, the Powerline 10 for finer calculus removal, and we will use the Powerline left curve and the right curve for the frications. So I would like to start her with Paradex for her after her initial visit in for 3 months until her next recall to kind of reset the bacterial load in her oral cavity. I have also chosen to use Clinpro 5000 instead of Gelcam because although I feel like the patient needs extra fluoride to prevent caries, I don't believe she will take the extra step needed for the Gelcam. Starting her off with a Nimbus Extra Soft toothbrush, and then once the tissues have recovered, possibly switching to a Sonicare. I think that will increase her time with her toothbrush because they have a timer and hopefully she will use it for the 2 minutes that she needs to be brushing for. She will need tufted floss and interdental aids in her type 3 embrasures as well as any areas with visible frications. I will also recommend Biotine to help ease her xerostomia and in-house varnish, fluoride varnish. As far as her nutritional analysis is concerned, thank you for listening to this PowerPoint here, and thanks. Concerned, her hyperthyroidism is a cause of issues. When you have hyperthyroidism, you tend to have bone loss and weakening of bones and brittle bones, and I think it's key to introduce foods that are high in calcium and other vitamins that she's probably been lacking since she might be drinking more of her meals than eating healthy ones. So to add to her diet, I have chosen things that she has said that she likes, such as spinach, white beans, cruciferous vegetables, lentils, tea. Um, those are healthy things that she can add to her diet. And we want to omit alcohol, which is going to take a lot on her part, and sodas and high sugar drinks. We also want to avoid spicy and acidic foods due to the fact that people with hyperthyroidism tend to have issues like burning mouth syndrome and stuff like that. So we want to avoid spicy and acidic foods. We also want to avoid foods high in iodine, which can affect urothyroid. So stuff like fish, seaweed, shrimp, lobster, and crabs, things from the ocean, tend to have a high level of iodine, so we want to avoid those. As far as supplements are concerned, we're really concerned with her bone health and bone density, so we want her to have calcium supplements and vitamin D supplements for her bone health. Iron is also important for her blood and her thyroid health, and zinc will help metabolize her foods properly.